nurses. We need highly trained nurses. So that partnership with CCC is critical for us to create that pipeline of nurses to come into the system to provide excellent care to the communities we serve.
Many of our students work full-time as PCTs at NAH, and that really strengthens the collaboration, as many of the nurse managers at the hospital really work with our students to create a schedule where they can continue to work and go to school to be nurses. And many of them will be hired on the unit where they currently work after they graduate.
I wish I knew the exact year that CCC started their nursing program, but since their very first class of nursing students, NAH, Northern Arizona Healthcare, has partnered with CCC. So we host CCC's nursing students from their first semester through their fourth semester in our clinical settings, and then always our biggest priority is to hire CCC nursing students because they are truly exceptional into Northern Arizona Healthcare, specifically Flagstaff, because they're residents of Flagstaff.
NAH was very important when our nursing program began. We had a lot of collaboration in 2003 when we opened our doors. And since then, NAH has been our strongest clinical partner, as well as jobs for our students when they graduate.
We'd much rather have someone local here who knows the culture, knows the community. It's their friends, it's their neighbors. To have them actually get into the program and then come to us, get their clinical training here, and then stay within the community is huge.
So for our graduate nurses, we have a residency program that's renowned across the country because we stay connected with our nurse residents for a year's time. So for CCC specifically, we train these folks through all 4 semesters of school. They're with us in their clinical setting, and then when they graduate and they're licensed nurses, we stay connected for 1 full year past their start date.
With NAH being the only hospital in this region, they provide all the required experiences that our students need, and that includes medical surgical nursing, critical care, maternal infant, pediatrics. We work very closely with them to ensure that all our students get the required amount of hours, and that has been very successful.
Organizations don't have relationships, people do.
Without those relationships, we wouldn't be as successful as we are. It's because of the relationship that I have with Catherine and the instructors that allow us and also motivate us to want to make sure that we're meeting the needs of CCC. Of the most recent graduating class, there were 25 graduating nurses, and we were able to secure 16 of those. So that dramatically changes the dynamic of our workforce. It allows us to decrease contract labor utilization. It allows us to decrease overtime burden on core staff when we're able to bring in new trained nurses. And to Dave's point, the connection with CCC and trained nurses who are our community members goes such a long way in being able to live our values of who we are at NAH. Being able to build community, being able to show compassion, and doing exceptional work is what we see from our CCC students.
Our students stay in Flagstaff and Coconino County, and that's really important because our students are residents of Flagstaff and Coconino County, and they will stay and they will give back and they will work in various healthcare settings in the community to help provide for the needs of our residents.
NAH is so wildly excited to partner with CCC on so many different levels, through our fire sciences, through our healthcare professions, with our nurses, with our EMTs, with our CNA program. There are so many ways that we partner with CCC, and we are thrilled to have that relationship because we recognize how much that benefits our community and the patients we serve. On behalf of Northern Arizona, we say thank you, Coconino Community College, for everything that you do for us, our patients, and our communities.